millions of Americans right now that are going to sleep tonight that have undiagnosed sleep apnea. Many of them are in your practice, in your family, your friends, maybe even yourself. It's surprising how many people actually suffer with this specific disease unknowingly because it happens while they're asleep. The person who's sleeping is actually the single worst source of information on how well they are sleeping and what's occurring while they're sleeping. The second worst source of information is the person who should be sleeping next to them at the same time. But usually we rely on those two people, the person or their spouse and significant other, to actually report about sleep apnea. That's why understanding the clinical comorbidities that we just discussed is so absolutely important in your conversation with your patients. Because if you can see what they don't, if you can look at their health history and gain insight from that, and then start talking to them about their life, that's the subjective information that we get from the conversation from them, we can start piecing things together and help them have a better picture of how they actually sleep and what's going on. So when we look at the undiagnosed population in America, we shouldn't be surprised that these numbers are tremendously high. As of 2012, the American Academy of Sleep Medicine estimated that there are 30 million Americans that are currently suffering undiagnosed with sleep apnea. That means that they're going to bed every night and choking at least 5 times an hour, waking up from that episode, falling back asleep to do it again. Every single night, every week, every month, year after year. That's a lot of people. Out of those 30 million people, roughly 10% have been diagnosed. That means 10% of that population that has apnea has actually had a sleep test, been diagnosed by a medical professional with this potentially life-threatening disease. Out of those 10%, shockingly, only 25% have yielded long-term positive outcomes to the gold standard of therapy, which is CPAP. Now, in our treatment planning series, we'll discuss CPAP, oral appliances, surgery, etc. in detail. But as it relates to this context, knowing that CPAP is the gold standard, it is the #1 prescribed treatment for sleep apnea. And out of the roughly 3 million people that have been diagnosed, approximately 1/4 of them are actually treated long-term on this treatment, being CPAP. That is a terrible statistic. Folks, if you're in a dental practice and you treated your orthodontic patients, say you do Invisalign or ClearCorrect or any type of clear aligners, if you could only successfully identify 10% of the patients that walked in with malocclusion, you would be blind. But just pretend that you treated all 10% of those and only 1/4 of them walked out with straight teeth. Now we have a really big problem. You see, the undiagnosed population of sleep apnea patients in America is staggering, but it doesn't have to be. With awareness and good conversation, we can help a tremendous amount of people. So let's step in together, let's do this, and start helping folks one at a time. Let's start chunking away at that undiagnosed population and do what we can.